In this video from Overpsyched, we are going to explore Antisocial Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. First, we will review the diagnostic criteria, then discuss some of the common features of antisocial personality disorder. We will review conduct disorder and its relation to antisocial personality disorder. We will explore the prevalence, development, and course of antisocial personality disorder, and we will conclude with our current understanding regarding the treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, has the following diagnostic criteria for antisocial personality disorder. Criterion A: a pervasive pattern of disregard for and violation of the rights of others, occurring since age 15 as indicated by 3 or more of the following. 1. Failure to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. 2. Deceitfulness as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure. 3. Impulsivity or failure to plan ahead. 4. Irritability and aggressiveness as indicated by repeated physical fights or assaults. 5. Reckless disregard for safety of self or others. 6. Consistent irresponsibility as indicated by repeated failure to sustain consistent work behavior or honor financial obligations. 7. Lack of remorse as indicated by being indifferent to or rationalizing having hurt, mistreated, or stolen from another. Criterion B: the individual is at least 18 years. Criterion C: there is evidence of conduct disorder with onset before age 15 years. Criterion D: the occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. So this is antisocial personality disorder defined by the DSM. But now let's explore some of the common features of this personality disorder. Characteristically, a poor or non-existent conscience is apparent. Disregard and violation of morals, social norms, and the rights of others. Individuals with this behavior have also been called sociopaths, psychopaths, or dissocial personality disorder, which is the term the ICD uses to describe antisocial personality disorder. Deceit and manipulation are central features. Individuals often seek to gain personal profit or pleasure, such as money or power. Malingering may also be common. Malingering is when an individual feigns an illness in order for a secondary gain, such as time off from work or some kind of monetary benefit. These individuals also frequently ignore the law and may be arrested. Physical fights are common, including with the spouse and/or the child, so physical abuse in the family can also be a concern. There is also often a reckless disregard for their safety as well as the safety of others. This may include reckless driving, substance use, risky engagement with others, and child neglect. Individuals with antisocial personality disorder may also have significant periods of unemployment despite available job opportunities. They may be indifferent, lack empathy, be callous or cynical, arrogant, or have a superficial charm. And if these individuals are in the armed services, they may receive dishonorable discharges. And finally, intellectual and cognitive ability in antisocial personality disorder is often impaired or reduced. So when discussing antisocial personality disorder, we should take a moment to review conduct disorder, because criterion C of the DSM's definition for antisocial personality disorder is that an individual must have conduct disorder before age 15. This is a unique criterion for antisocial personality disorder. Other personality disorders do not have a prerequisite diagnosis. Conduct disorder is described as a repetitive and persistent violation of the basic rights of others. This may include aggression to people and animals, destruction of property, deceitfulness or theft, or serious violation of rules. If the onset of conduct disorder was before age 10 years, then this increases the risk of developing antisocial personality disorder even greater. Child abuse or neglect, unstable parenting, or inconsistent parental discipline increase the likelihood that conduct disorder will transition to antisocial personality disorder. And roughly 25 to 40% of youths with conduct disorder will evolve into antisocial personality disorder. So again, unlike the other personality disorders, antisocial personality disorder requires evidence of a childhood disorder, specifically conduct disorder. Now let's transition to discuss the prevalence, development, and course of antisocial personality disorder. Antisocial personality disorder is more common in first-degree biological relatives with this disorder. Individuals with first-degree biological relatives with antisocial personality disorder are also at increased risk of somatic symptom disorder and substance use disorders. Within a family that has a member with antisocial personality disorder, males more often have antisocial personality disorder and substance use disorders, and females more often have somatic symptom disorder. Adoption studies also indicate that both genetic and environmental factors contribute to the development of antisocial personality disorder. Additionally, some studies suggest that there is a specific gene, the MAOA gene, which is involved in the development of antisocial personality disorder. If you are studying psychopharmacology, you may recognize that this enzyme, the monoamine oxidase A, is relevant for some of our medications. However, as we will discuss in a moment, medications aren't that effective for antisocial personality disorder. And we just explored the connection between conduct disorder and antisocial personality disorder. But childhood ADHD is also associated with an increased risk of antisocial personality disorder. However, conduct disorder is a prerequisite. ADHD is not. And some of the common comorbidities with antisocial personality disorder are the following: anxiety disorders, depressive disorders, substance use disorders, somatic symptom disorder, gambling disorder, and other disorders of impulse control. Frequently, individuals with antisocial personality disorder have personality features that meet criteria for other personality disorders, particularly borderline, histrionic, and narcissistic personality disorders. These are the other cluster B personality disorders. The prevalence of antisocial personality disorder is estimated between 0.2% and 3.3%. The highest prevalence, above 70%, is among males with alcohol use disorder and those from substance abuse clinics or prisons. The prevalence is also higher in those with adverse socioeconomic, such as poverty, or sociocultural, such as migration, factors. Antisocial personality disorder is more common in males than females, and this may be partly due to underdiagnosing females because conduct disorder, the prerequisite for antisocial personality disorder, is thought to be underdiagnosed in females. Antisocial personality disorder may remit as the individual grows older, particularly around the 4th decade of life. So now let's discuss some of the subtypes of antisocial personality disorder. These are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. The first is nomadic antisocial. These are described as drifters, roamers, adventurers. They typically adapt easily in difficult situations. Next is malevolent antisocial. These are belligerent, vicious, sadistic, malignant, and it includes serial killers. The next is covetous antisocial. These are envious, hostile, rapacious. They pleasure more in taking rather than having. Next is risk-taking antisocial. These are dauntless, intrepid, audacious, daring, and these individuals disregard hazards. And finally, there is reputation-defending antisocial. These individuals need to be considered unbreakable, infallible, and they may overreact to slights or when their status is questioned. Now we are going to conclude with a discussion on treating antisocial personality disorder. Antisocial personality disorder is considered one of the most difficult personality disorders to treat. Individuals frequently fail to display any remorse or see the costs of their antisocial actions. Outpatient therapy is likely not going to be successful. Treatment is often done with the criminal justice system as part of their imprisonment. And due to the high comorbidity of substance use disorders, individuals must be strict regarding their substance use. Talk therapy and schema therapy may be beneficial for these individuals. And providers must be mindful of countertransference, that is, negative feelings that the clinician has towards the individual. Research regarding the use of medications in antisocial personality disorder is limited. There are no medications that are FDA approved specifically for antisocial personality disorder. For concerns of agitation or aggression or impulsivity, then antipsychotics or mood stabilizers may be considered, but these are more treating symptoms of the disorder rather than targeting the core personality disorder itself, which is very difficult to address. That will wrap up this video. Thank you for watching, and be sure to head over to overpsyched.com for more helpful resources.